Welcome to the weekly checkup on ReachMD, your source for the latest medical education, breaking news, and compelling editorial topics. This week, we take a look at head injuries. While concussion symptoms are generally subtle and delayed in nature, a new blood test may hold the key to early detection. Researchers from Orlando Health were able to identify signs of concussion in patients nearly a week later after sustained head injuries. The team targeted the glial fibrillary acidic protein, a biomarker in the brain that passes into the bloodstream following injury. With a 97% accuracy rating, this method of concussion detection could change the way healthcare professionals diagnose head injuries, particularly in athletes and children. For more related content, head to reachmd.com. April marks the start of Autism Awareness Month, and at ReachMD, we're bringing expert insights on autism into greater focus. Here with a special announcement about ReachMD's latest updates and features advancing autism awareness is host Paul Rakuski.
Hello, I'm Paul Rakuski, host of the Autism Spectrum series on ReachMD. I want to talk to you about Autism Awareness Month, a cause which is near and dear to my heart. This April, ReachMD will be taking a deeper look at this disorder through our curated Autism Awareness playlist. Learn about the latest research, diagnostic approaches, patient challenges, and the evolving roles of healthcare professionals in treating autistic patients. Learn more by heading to reachmd.com/autismawareness.
After catching up on the latest autism education, check out the segment entitled Complex Aortic Disease, Sussing Out a Silent Killer to Save Lives. Learn about the nuances of diagnosis and treatment guidelines. And for those of you keeping a close eye on the latest clinical research in HIV, here's a clip from the new Clinicians Roundtable episode on gene editing technology and the promise it may hold to finding an eventual cure for HIV and AIDS.
Now, there are small populations of the T lymphocytes retained incorporate the virus genome in the latent stage. These cells are called reservoir, usually memory T cells, or the one that retains this basically latent virus genome. So every time that the patients stop taking antiretroviral drugs, the virus rebounds and then viremia happens, and they again go back to the stage of moving toward the AIDS. Now, the way that we can stop this event is inactivating viral genome or excising entire viral DNA from the chromosomes. So we look at the problem as a genetic problem, not infectious disease problem. To this end, we try to find a way to excise integrated copies of the viral DNA from the T cells. So we use the gene editing strategy, which over the last 2 and 3 years received special attention by the biomedical community, so-called CRISPR-Cas9 gene editing. It was about 3 years ago. And we customize, refine this gene editing to specifically identifies and recognizes integrated copies of HIV in the cells.
Check out the full program entitled Gene Editing HIV Out of Infected Cells Is the Cure for AIDS in Sight on reachmd.com or tune in on any one of our recommended platforms. On behalf of everyone at ReachMD, thank you for joining us today. I'm Sherry Neely, as always, inviting you to be part of the knowledge.